Dr. Elnahal, it's a pleasure to get you back on. I wish certainly it was under better conditions. Can you give us first an update on the conditions in your hospitals? What is your hospitalization utilization? What are the available beds? What are you seeing on the ground right now?
Well, thanks so much for having me on. First of all, we're all concerned about the rise in cases, and we know that cases precede hospitalizations and hospitalizations precede deaths. And so we're all waiting with bated breath on what that's going to look like in our community. We have about 15 patients with COVID-19 in our hospital right now. That's up from just about 5 or so about 10 days ago. So still overall small numbers, but we're seeing a rise in folks coming to the emergency room, and we're seeing a rise in children coming to the emergency room, which is the most concerning. We've had more children in our hospital with COVID-19 than we've really ever had in the pandemic in hospital beds, but we're also seeing a good number come through our emergency room. So we're all watching that closely to see what happens.
Yeah, we're also seeing this double whammy with kids of this rise in seasonal flu as well, are we not? So-called RSV, which is a respiratory virus, normally normal, hits in the winter, hitting early this year. Are we kind of seeing a double hit for our kids right now?
We are, and we're actually seeing folks come in with kids that have RSV and kids that have COVID at the same time. And of course, you have to make sure you're wary about the possibility of double infection at the same time. We're also worried about what flu season is going to look like in the fall, because as you know, last year there were many more restrictions across the country about what folks could do and could not do, which led to historic lows actually in flu infection. This year is going to be different. It's going to be different here in our community and in the New York metro area. And so we're bracing ourselves for what could be a simultaneous COVID surge and flu surge in our hospital. So we're doing everything we can to prepare. We've got the PPE, we've got the surge plan, the beds are available. We know the playbook now. We're all just bracing ourselves to see what comes.
And what do you think is going to happen? I mean, Dr. Elnahal, what's your best guess as to how the fall might look? Because New Jersey cases, and again, cases, not the best metric, hospitalizations and outcomes are, we know that, but cases can tend to precede that. They're up more than 500% in New Jersey, one of the most highly vaxxed states in the country, by the way, in a month. What's your best guess for the fall, doctor?
Well, we don't actually have to just guess. We have projections based on the case rates of transmission and what we're already seeing in hospitalizations. And we are projected to see a steep increase in September, with a peak in New Jersey that could be anywhere between October and December, depending on how bad Delta gets. I really want to reinforce this. This is entirely preventable at this point, and that's what's frustrating our frontline workers. Everybody's on the same page now in our hospital, now that we instituted our mandate, that we need to make sure that as many environments as possible, as the Norwegian Cruise Line CEO was just saying, have mandates and are compelling folks to do it in order to, have the privilege of potentially exposing others. That is what our healthcare workers are saying. They're exhausted. And we need to make sure that everybody's doing their civic part so that we don't have to deal with this. We have early stage cancer that we have to detect. We have patients to see in our clinic. We need to move on, and we can't move on unless folks get vaccinated. So I do support mandates wherever possible.
We've got 81% of New Jersey adults getting at least one shot, but it's a big state, about 9 million people. Let's say that half of those are adults, or just a little over half. You do the back of the envelope math. That would imply there still may be more than 1 million adults who have not had any shot of the vaccine. I don't know if you have the numbers. I don't want to put you on the spot, doctor, but of those you are seeing coming in or hospitalized, not including children, because the vaccine not authorized for them. We know that it's not authorized for anybody, actually, but it's not used for them. Are we seeing mostly the unvaccinated who are coming into your hospital system?
Almost exclusively unvaccinated people coming to our emergency room and being admitted to the hospital. It's really important to reinforce that these vaccines are effective. They're very effective, even against the Delta variant. And just this week, there was a study released out of South Africa that showed that Johnson & Johnson is also quite effective at preventing hospitalization and death. And that was somewhat of an open question before that. So we have 3 vaccines that can prevent hospitalization and certainly can prevent death. And so when our healthcare workers see folks come in, sick with COVID-19, you can understand why they're so frustrated, because we're not at a point where this is just a crisis that we all have to face. This is entirely preventable, and our vaccines can do that. And so, we do have pockets also in New Jersey that are particularly under-vaccinated. We see that in Irvington and some of the surrounding towns near Newark. Newark is getting better and better, but hospitals like ours in urban areas and dense areas are facing the brunt of this, because it's also a situation where we're in under-vaccinated areas relatively.
And very quickly, I know we got to go, doctor, but talk to us about that. You've talked to us before. We are seeing lower vaccination rates in some of the urban areas as well. Sort of, there's two areas that tend to have lower rates. You've got sort of very rural areas and very urban areas. For you, where you are you seeing a lessening in vaccine hesitancy among your population, among the folks who would use your hospital system? Has it changed at all?
It has changed, and it's changed in a really positive way. So Newark is almost at 70% of adults with at least one dose, lagging behind the rest of the state and the rest of the country overall. But remember, Newark and the surrounding towns are predominantly a community of color. In the beginning of this experience, a lot of folks in our community were hesitant, but they weren't in the absolute hesitant category. They were sort of in the wait and see how my community members, my leaders are doing with vaccination. And so we've been able to take advantage in recent months, recent weeks, especially because of Delta, in reinforcing that these vaccines work, and even canvassing, going door to door, doing global events, which has been successful. So there's promise to really vaccinate even more people here.